When it comes to your health, you've probably done everything right. You try to eat well, stay active when you can, and maybe take a few vitamins to stay strong. That's what we were told, right? Take your supplements, protect your bones, keep your mind sharp. But what if I told you that some of those same vitamins, the ones you take every day without thinking, could quietly be doing more harm than good? As a brain health specialist, I've seen older adults suffer strokes, memory loss, nerve problems, and not because they smoked or skipped exercise, but because they were taking over-the-counter supplements in doses far higher than they needed. And no one warned them. That's why I'm having this conversation with you today. Because you deserve to know what could really be going on inside your body. In the next few minutes, I'll walk you through 5 common vitamins that many older adults take every day, vitamins that can silently raise your risk of stroke, brain bleeds, or nerve damage, especially while you sleep. I'll also explain what to do instead, so you can protect your brain and stay independent for as long as possible. Before we dive in, I'd love to know, where are you watching from today? Drop your city or state in the comments below. I always love seeing how far our community is reaching. 1. Vitamin D, helpful or harmful? You've probably heard for years that vitamin D is important for your bones, especially as you get older. And that's true, to a point. But what most people over 60 are never told is that too much vitamin D can quietly put your brain and heart at risk, especially if you're taking it every day without checking your levels. Let's break it down. Vitamin D helps your body absorb calcium. Sounds good, right? But here's the catch. When you take high doses of vitamin D, especially those 5,000 or 10,000 IU capsules you find in drugstores or online, your body can end up with too much calcium in the blood. And your body doesn't know where to put it. So guess what happens? That extra calcium starts building up in your arteries, making them stiff and narrow. Over time, this raises your risk of high blood pressure, poor circulation, and worst of all, a stroke. Now, I know many older adults think, well, I'm taking it to protect my bones. I hear that all the time. But your body changes as you age. Your kidneys slow down. Your arteries get more sensitive. That means what used to be a helpful dose of vitamin D might now be too much for your system to handle safely. Here's something else to keep in mind. Many seniors take vitamin D at night, thinking it will help them rest or avoid forgetting. But nighttime is actually the worst time to take it. Why? Because your body naturally loses water overnight, and your blood pressure tends to rise in the early morning hours. If you've taken a high dose of vitamin D before bed, it can lead to a spike in calcium just when your arteries are already under pressure. That's a dangerous combination, one that could lead to a silent stroke while you sleep. So what should you do? First, check the label on your bottle. Are you taking more than 1,000 or 2,000 IU a day? If so, it's time to talk to your doctor. Second, make sure you're only taking it in the morning. And third, ask yourself if you even need it. Many people take vitamin D without ever getting a blood test to see if they're actually low. You don't need to be scared, but you do need to be smart. Because protecting your brain means knowing what's going in your body, even when it comes in a tiny capsule. 2. Vitamin E, the heart helper. If you've been taking vitamin E for years to help your heart, you're definitely not alone. It's often called a heart-healthy antioxidant, and many people over 60 take it hoping it'll improve circulation, memory, or even skin. But what hardly anyone tells you is this: in high doses, vitamin E can quietly thin your blood too much, especially if you're also on heart medications, and that can lead to something much worse than a clot, a brain bleed. I want to say this clearly because it surprises so many seniors. Vitamin E acts like a natural blood thinner. That means if you're already taking aspirin, Plavix, or a prescription blood thinner like warfarin, and then you add high-dose vitamin E on top, you're increasing your risk of internal bleeding, especially in the brain. And unfortunately, most people don't feel it happening. One small blood vessel gives out, and suddenly, you're confused, dizzy, or worse. You might be thinking, but it's just a vitamin, how bad can it be? Well, here's the problem. The recommended daily amount of vitamin E for older adults is about 15 milligrams, which is roughly 22 IU. But go into any supplement aisle, and you'll see bottles with 200, 400, even 1000 IU per capsule, with no warning labels. Many people take those every day for years, without ever realizing how risky it can become when combined with certain medications or health conditions. I remember a patient who sticks with me to this day. She was an 81-year-old woman, bright and active, who started taking a natural vitamin E supplement she saw advertised for memory. Within weeks, she ended up in the hospital with a serious brain bleed. Her blood was simply too thin. She survived, thankfully, but her memory never fully recovered. And all she said was, "I thought I was doing something good for myself." 3. Vitamin B6, the nerve support. You've probably seen vitamin B6 in brain-boosting or energy supplements. Maybe the label said something like, supports nerve health or helps memory and focus. And for a long time, doctors recommended B6 for older adults with tingling, fatigue, or nerve pain. But here's what they don't often tell you: too much B6 can actually do the exact opposite. It can quietly damage your nerves, sometimes permanently. That's right. The vitamin that's supposed to protect your nervous system can actually harm it if taken in high doses over time. And sadly, most people don't even realize what's happening until it's too late. The symptoms come in slowly. Maybe your feet start to tingle, or your hands feel numb. Maybe your balance feels off, or you start tripping more often. At first, it feels like normal aging. But in reality, it could be vitamin B6 toxicity. I once met a retired truck driver, 76 years old, who had been taking a nerve support supplement he bought over the counter. It had 100 milligrams of B6 in every tablet, and he was taking 2 a day. That's 200 milligrams daily. Let me put that into perspective. For older adults, the safe upper limit is about 100 milligrams per day, and in most cases, you only need around 2 to 10 milligrams. He was taking 20 times the amount his body needed. And it wasn't flushing out, it was building up. That's the dangerous part. Unlike vitamin C, which washes out in your urine, vitamin B6 is stored in your body. Over time, it can wear down the protective layer around your nerves, kind of like stripping the insulation off a wire. That's what causes those strange sensations, weakness, and loss of coordination. And if it goes on long enough, the damage may not fully heal. He told me, "Doc, I just wanted to protect my brain. I didn't think I was hurting it." And I hear that far too often. So here's my advice: if you're taking a supplement labeled brain, nerve, or energy, check the dosage of B6. If it's over 50 milligrams, especially if you're taking it daily, talk to your doctor. And remember, just because something is sold in a health store doesn't mean it's safe in high amounts. 4. Vitamin A, the vision vitamin. Most older adults know vitamin A as the one that helps with eyesight. Maybe you've taken it for that reason, or because you've heard it's good for your skin or your immune system. And yes, in small amounts, it's important. But there's a hidden side to vitamin A that many seniors never hear about. When taken in large doses or over long periods of time, it can silently build up in your body and raise the pressure inside your skull. That can mimic a stroke, and in some cases, lead to permanent damage. Here's why this happens. Vitamin A is fat-soluble, which means your body stores it in your liver, tissues, and even your brain. It doesn't flush out easily like water-soluble vitamins, like B and C. As we get older, our metabolism slows down, and our liver isn't as efficient as it once was. So if you're taking high-dose vitamin A every day, especially if you're also using multivitamins or anti-aging supplements, it can quietly build up over time. The result? You might start having headaches that don't go away. Your vision might become blurry. You may feel dizzy or confused. In more serious cases, your speech can slur, or your coordination may change, symptoms that look and feel like a stroke. But when doctors scan your brain, they don't find a clot or bleeding. Instead, they see something called pseudotumor cerebri, a condition where your brain feels like it's under pressure from the inside. I once treated a 79-year-old piano teacher who had been taking a high-dose eye and skin supplement for years. She thought she was doing the right thing. But she ended up with pressure on her optic nerve and had to go through months of therapy. She told me, "I never imagined a vitamin could cause all this." That's what makes vitamin A tricky. Most multivitamins already give you the full amount you need, about 2,500 to 3,000 IU per day. But some supplements go far beyond that, 5,000, 10,000, even more. And if you're taking more than one product, it adds up quickly. So here's what I want you to do: check the labels. Look for how much vitamin A you're getting each day. And if you're unsure, bring your supplement list to your doctor. It's not about giving things up, it's about staying safe and making sure your good intentions don't backfire. 5. Niacin, the cholesterol fighter. Niacin, also known as vitamin B3, is often praised as a natural way to support heart health. Maybe your doctor recommended it for your cholesterol. Or maybe you picked up a supplement labeled "support circulation" or "heart function." That sounds reassuring, right? But here's what you're not being told: high doses of niacin can quietly cause dangerous swings in your blood pressure, especially in older adults. And in some cases, it can lead to something as serious as a stroke. Let me explain how. Niacin works by opening up your blood vessels. That's why some people feel flushed or warm in the face after taking it. It's called a niacin flush. But here's the tricky part: after that flush, the blood vessels snap back, they narrow quickly, and that sudden shift can cause your blood pressure to spike. Now imagine that happening in the early morning, when blood pressure is already naturally higher. That combination is risky, especially for your brain. I met an 82-year-old man who had been taking a flush-free niacin supplement twice a day. Each capsule had 1,000 milligrams of niacin, which is over 60 times more than most older adults need. He thought it was safe because the label said natural and heart-friendly. But he started experiencing odd symptoms: hot flashes in the morning, dizziness, pounding in his chest. His wife thought it was anxiety. His son blamed his blood pressure pills. But what no one realized was that it was the niacin supplement quietly causing the chaos. He ended up having a TIA, or mini-stroke. Thankfully, it was temporary, and his speech came back, but it was a serious warning. High-dose niacin doesn't just mess with your blood pressure. It can also trigger heart rhythm problems, raise blood sugar, and stress out your entire circulatory system. Here's what you need to know: older adults should not take more than 50 milligrams of niacin per day unless a doctor has prescribed it. And if you're already on medication for blood pressure, cholesterol, or heart rhythm, mixing in high-dose niacin can make things worse, not better. By now, you've seen how common vitamins, ones you may have trusted for years, can quietly cause harm if they're not used carefully. And I know it's a lot to take in. You might be thinking, if I can't rely on supplements, then what can I do to stay healthy? The good news is, your best defense has been right in front of you this whole time: real food. Your brain wasn't built to run on pills. It was designed to thrive on fresh, whole foods that deliver nutrients in just the right amounts, at just the right pace. No megadoses. No guessing games. Just gentle, steady support your body understands. I once worked with a 73-year-old woman who had a cabinet full of pills: vitamin D for bones, vitamin E for heart, B-complex for energy, niacin for cholesterol, and a multivitamin, just to be safe. She was doing everything she thought she should, but still felt dizzy, tired, and foggy in the mornings. Her blood pressure was unpredictable. Her balance was off. So, we tried something different. Instead of more pills, we built her health back with food. Breakfast looked like this: 1 boiled egg for clean protein, Half an avocado for healthy fats. A slice of whole grain toast for steady energy. A small handful of blueberries packed with brain-protecting antioxidants. A glass of room-temperature water to rehydrate the brain. Simple. No powders. No pills. Just nourishment. Within weeks, she felt stronger, clearer, more balanced, and for the first time in years, she wasn't afraid to move around on her own. And this isn't just her story. It could be yours too. So if you're asking yourself what changes to make, start small. Add leafy greens like spinach or kale. Include a bit of fatty fish like salmon. Snack on walnuts or almonds. Drink more water. Eat food that your body recognizes and can truly use. Remember, it's not about cutting everything out. It's about knowing what helps, and what doesn't. You've taken care of others for most of your life. Now it's time to take gentle care of yourself. And if even one part of this message made you think twice, I'd love to hear from you. What's one small change you'll start with tomorrow? Let me know in the comments. Someone else might read your answer and feel inspired to make a change too. Because you're not just aging, you're still growing. Still learning. And it's never too late to take back control of your health. If you've made it this far, I want to thank you. You care about your health. You're willing to learn. And that alone sets you apart. The truth is, life after 60 comes with changes. Your body is different. Your brain is more sensitive. And the routines that once worked may not serve you the same way now. That's not your fault. It just means it's time to adjust with wisdom, and with love for the body that's carried you this far. Here's the most important thing to remember: supplements are tools, not shortcuts. They can help, but they can also harm when misused. Your body doesn't need megadoses. It needs balance. It needs support. And most of all, it needs attention. Listen to your body. Ask questions. Read the labels. Don't be afraid to speak up to your doctor and say, "Is this still right for me?" You're not being difficult. You're being wise. If anything you read today made you pause, if it made you think, maybe I need to look at my supplements again, then you've already taken the first step. Stay strong. Stay curious. And most importantly, stay connected to what truly supports you.